all the bubbles on it.
Right, exactly.
That's what this room.
Right, you touch the screen here and like whatever's down here, like. Oh boy, 1 second.
Wow. What's that light all about? I know.
I want you to know it looks like you have like a circle light.
Whew.
Right?
It's kind of bright.
Don't ever look
Yeah.
directly into the light.
Yeah, I sort of accidentally did.
Now you told her don't look directly at it.
It's a little late for that,
I know,
Dan.
I try not to acknowledge it's a double-edged sword. You tell people to do it, they look at it. It's like, don't go outside and look at the sun, you're gonna die.
Good? You good? Okay. All right. Good afternoon, everybody. It is May the 1st. It is the end of the 8th week of coronavirus here in Montgomery County. We got our first 2 cases March 7th, which will be 9 weeks tomorrow. So, I am Dr. Val Arkush, Chair of the Board of Commissioners. I'm here with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale. Dr. Brenda Weiss is not with us today, but Dr. Al Wong, our Regional EMS Director, is. Since our April 30th press briefing, we have had 119 new positive cases of COVID-19 in Montgomery County, which brings us to a total of 4,310. These positive individuals are from 31 municipalities, none of which are reporting new cases. This keeps us to 61 of our 62 municipalities that are home to individuals with COVID-19. These individuals range in age from 11 years old to 104 years old. And as always, you can check our maps at moncopa.org/COVID-19 for the updated municipal counts and age counts. Today we have 58 females and 61 males. 8 individuals are known to be hospitalized. 10 individuals are known to be at home in isolation. And 101 we do not have information on. I am also saddened to confirm that 18 more Montgomery County residents have lost their lives to COVID-19, which brings us to 293 deaths confirmed positive from COVID-19. 77 of these 18 individuals were hospitalized, 9 passed away in a home or residence, and 2 we do not have information on. These 18 individuals ranged between the ages of 66 and 102. Overall, since the pandemic began here in Montgomery County, we've had 154 females and 139 males who have lost their lives to COVID-19. 12 have identified as Asian, 2 as Asian Indian, 3 as Asian Korean, 28 as African American or Black, 91 as white, and 157 we do not have information on. Regarding probable deaths, and as a reminder, these are individuals who have COVID-19 listed as the cause of death on their death certificate, but as of yet, we have not confirmed that with a lab test. Some of these individuals, we do get a confirmatory lab test eventually, and usually in a day or two. Some did not ever have any lab testing done, so we will never be able to list them as a confirmed positive. Today, we have 130 total probable deaths. So adding that to our confirmed total, that is a potential of 423 individuals in our county that have died from COVID-19. Our hospital situation remains pretty much unchanged. We have approximately 400 COVID-19 patients currently hospitalized, and about a quarter of them are on ventilators in the intensive care unit. Thankfully, to everyone's hard work and staying at home, we have flattened that curve, and so our hospitals have not been overwhelmed by the total number of individuals who've required hospitalization or required care in an intensive care unit or a ventilator. And we very much hope to keep that situation unchanged, that our hospitals will have capacity for anyone who needs to be hospitalized for any reason, whether it's COVID-19 or some other medical condition. The long-term care facility update today, we remain with 90 facilities that are reporting positive cases of COVID-19 in their residents or staff. We remain, same as yesterday, 1,114 cases among residents. I remind you this is self-reported from the facilities, and 458 among staff, 458 cases among staff, which brings us to a total of 1,572 individuals. A reminder that not all of these individuals are Montgomery County residents, and so these numbers don't exactly tie up to our totals, our official totals for the county. But we continue to believe it's very important that the public understands the very serious and very real challenges that are being faced at a number of our long-term care facilities here in the county. In terms of confirmed positive deaths of Montgomery County residents that are associated with a long-term care facility, we have 249 of the 293 confirmed positive. So that gives us a total of 85% total confirmed positive deaths. We continue to do daily outreach to these facilities. Today we had a debrief on a number of facilities, 27 visits that have now occurred, and actually the teams are back out today visiting more facilities. I don't have the exact number of how many facilities were scheduled to be visited today. By all reports, the facilities are finding these visits helpful. That is what they are designed to be. We go in and just review infection control policies, how staff is using PPE, answer any questions that they have, assist them with any unmet staffing needs, should they have any, just do a general check-in. And so far it seems to be going well and have been of some assistance to these long-term care facilities. Update from our Montgomery County Correctional Facility. Things continue to be stable there. All inmates, 171, who tested positive and were asymptomatic, continue to be asymptomatic as of this morning. Our community-based testing continues to also go well. The Norristown site was closed today, and there were some concerns about the weather, and will remain closed over the weekend. So for the Norristown walk-up site, which is available to Norristown residents only, appointments will open again for Monday, and those appointments will open Monday morning at 8:30 a.m. by calling 610-592-0680. That's 610-592-0680. That's for the Norristown only walk-up clinic. The clinic is actually open from 11 to 1 for that testing. In terms of our drive-through clinic at the Montgomery County Community College, the site is open and running smoothly today. And as of the 28th of April, at that site, together with the Norristown site, we have tested 2,774 individuals between the dates of April 16th and April 28th. We have received results on 2,626 of those individuals, which is 95% of the total. 393 individuals have tested positive. So for the first 13 days of our phase 2 of our community-based testing, we continue to run 15% positive. So that is certainly encouraging. We are at a plateau. That curve, instead of spiking way up, has remained flat for the last 13 days, so that is encouraging. But what we need to do is get those total numbers down lower. I would love to see that positive rate in the single digits instead of in the double digits. So we are holding steady, which is great. We just need to do a little bit better in terms of getting those numbers down. The drive-through site will be open tomorrow, Saturday. Appointments for tomorrow will open at 8 a.m. in the morning. Appointments can be made online at montcopa.org/COVID-19 by clicking on the green County Testing Information button. If you don't have good internet access or don't have an email, you can call 610-631-3000 beginning at 8 a.m. tomorrow morning for Saturday appointments. We have room for 250 people at the community college tomorrow, so we encourage people to get tested who need to be tested. The site will be closed on Sunday just for a routine safety stand down to give the team out there a break on Sunday. So then appointments for Monday will open up at 8 a.m. Monday morning. Do have a couple of other announcements. We will issue a press release tomorrow, Saturday, and we'll aim to do that by 3 o'clock tomorrow afternoon. We are not going to issue a press release on Sunday. We're going to take a pass Sunday, and we will, of course, be back here in person on Monday. A reminder, today we just want to remind you there is still time to shape your future and fill out your census. This weekend there is a big digital social media push by the census to remind everybody to fill out their census. Here in Montgomery County, 65.7% of households have completed their census survey, which is good. But remember, this is really important, if only 5% of households in Montgomery County do not complete their census, we've calculated that we are at risk of losing $72 million a year for the next decade in federal and state funding for all sorts of services, from human services to infrastructure. And given what we've been going through for the last 8 weeks, I hope everyone out there understands how important this funding will be to our recovery as a community. So please make sure you fill out your census. If you do not fill out your census, money that is rightfully ours here in Montgomery County will go to some other place, because it's all done by the number of people that are counted. So it's not like that money's going to go nowhere. It's going to go to another county or maybe another state who did a better job of counting than we did. So these are funds that are rightfully ours, so please fill out your census so we can get our fair share here in Montgomery County. I also want to note that it's May 1st, which is International Workers' Day. This is a celebration of labor, and this year in particular of essential workers. From the grocery store clerk to the custodian to the telecommunicators answering your 911 calls to the public health professionals that are crunching numbers every single day, to the food processing employees, to the staff at our long-term care facilities, to the pharmacists, the public safety professionals, the first responders and hospital workers, to the teams keeping our electricity on, our internet working, our toilets flushing, and our water running, to the people shopping and delivering your groceries and other goods, and so many others, thank you. Thank you for being out there every day, helping to take care of our community and keeping our community safe. And we have not forgotten all of you that wish to be working, but are staying at home. You are an essential part of the fight against COVID-19, and we are grateful for that too, and hope that you will be back at work as quickly as possible. And with that, I will turn over to Commissioner Lawrence.
Okay, good afternoon. Today is Friday for those who are still keeping track. And it looks like we're going to have some really beautiful weather this weekend. So it's an ideal time to get outside for some mental and physical wellness during the COVID-19 pandemic. We anticipate that we'll have a lot of activity on our trails this weekend, so we ask people to please maintain physical distance while they're there. But in addition to our popular trail network, there are a lot of opportunities to exercise right in our own neighborhoods. And one of these ways is through our Bike Monco program, which enhances the county's efforts to advance bike and pedestrian mobility. There's 90 miles of trails, bikeable trails in the county trail system, but there are only 24 miles of bike lanes in the whole county. We're excited that PennDOT will be adding another 8.3 miles of bike lanes throughout the county in 2020 as part of their road resurfacing efforts. During the COVID-19 stay-at-home order, trail usage has increased by 100 to 200% in some areas, which has made it challenging to practice proper social distancing. So in response, the Montgomery County Planning Commission has developed a new website to empower residents to walk, jog, run, and bicycle on neighborhood streets and local roads. The site features an interactive map that highlights the thousands of miles of local streets throughout the county that are considered low stress and which can be used comfortably by bicyclists and pedestrians. The public can enter their address to find a suitable network near where they live and will discover that many of these streets start right in their own neighborhood. So check out this new website entitled Low Stress Streets for Bicyclists and Pedestrians, and that's at www.montcopa.org/getoutandgostreets. That's www.montcopa.org/getoutandgostreets. So I encourage everyone to take advantage of the weather this weekend to get out and walk or ride, but please continue to be responsible and practice social distancing guidelines to keep our communities safe and healthy. And if you're riding, please wear a helmet. And I've also heard a rumor that golf courses will be open this weekend as well. I'm going to talk a little bit about mental health. As the weeks of social distancing turn into months, many people are experiencing a greater and greater sense of isolation. They are also dealing with the uncertainty of when and how this pandemic will end, the fear of getting infected, the economic crisis that has cost millions their jobs, and the inconsistent messaging about the virus across multiple platforms. So, while we're focusing on flattening the curve of COVID-19, let's also make sure that we try to prevent a spike in mental health crises. The Montgomery County Department of Human Services, DHS, and the Center for Community Resources, CCR, is always there to help and has created a new statewide support and referral helpline. This is available 24 hours a day, 7 days a week to respond to those who are struggling with anxiety and other emotions due to the COVID-19 emergency. The mental health support line, Warm Line, can be reached toll-free at 1-855-284-2494, and that's 1-855-284-2494, and that's 24 hours a day, 7 days a week. And even if you don't consider yourself to be creative or have any artistic ability, artistic expression can provide great therapy. So I wanted to announce that the Montgomery County Community Support Program's 2020 Virtual Art Contest is being held right now. The theme is appropriate. It's life isn't about waiting for the storm to pass, it's about learning to dance in the rain. The deadline to enter is May 15th, 2020, and voting ends on May 22nd. Cash prizes will be awarded for the top entries. And if you're interested in competing, you can find more information at www.montcopacsp.org and click Art Contest at the top of the page. And finally, a few weeks ago, Representative Cerisi led an effort in Montgomery County for places to ring bells to recognize our first responders. On Sunday, it's bells to ring across PA on Sunday. So we're asking all places of worship and others with access to bells to ring them for 3 minutes beginning at 7 p.m. to honor hometown heroes, celebrate those on the front line of the COVID-19 pandemic, and show our resolve and solidarity to restore local business and civic life. And with that, I'll turn it over to Commissioner Joe Gale.
Happy May 1st, everyone. I'm Montgomery County Commissioner Joe Gale. With spring and warm weather comes farmers market season in Montgomery County and throughout the Commonwealth. Like grocery stores, farmer markets offer life-sustaining food and essentials. Farmers not only work hard year-round to push food to grocery stores, but they also work hard to stock their own market shelves and feed their local communities. They are a fundamental piece of Pennsylvania's supply chain. As a life-sustaining supply chain, the Department of Agriculture issued guidance for farmers markets and on-farm markets with recommendations on how to continue operations safely and minimize contact for shoppers and employees. The guidance includes phone-in and online orders with delivery or pickup options, pre-packaged bags of fruit, vegetables, and other items to limit shoppers' handling of food and allow customers to move through the facility more quickly, designated times for high-risk and elderly persons to shop at least once a week, separate stands to limit crowds and consider limiting the number of customers in the market at one time, and if possible, have a different person handle products and handle money, or wash hands and sanitize between tasks. The guidance also offers farms the opportunity to open an on-farm stand to sell raw produce, eggs, or shelf-stable packaged food items such as jams, jellies, or baked goods without additional food safety licenses. Pennsylvanians interested in supporting local farmers can find a market by visiting pafarm.com or by looking at the PA Preferred logo when shopping in a grocery store. You'll see a PA Preferred logo on the items for a guarantee that you are supporting a Pennsylvania farmer. This COVID-19 pandemic has highlighted how important food and food supply chains are in our lives and the economy. Here in Montgomery County, we have approximately 500 farms. It's about 10% of our acreage countywide is made up of farmland, and it plays a major role and impact in our local economy. So I highly encourage the residents to get out and support our local farmers at the farmers markets. Also, I have an update on PennDOT construction projects. The Pennsylvania Department of Transportation has announced that beginning today, May 1st, they will begin a phased-in reopening of public and private construction projects. In response to the governor's COVID-19 mitigation guidance on March 17th, PennDOT paused construction projects statewide except for emergency needs. Now, PennDOT road and bridge construction projects will restart with the practice of social distancing and COVID-19 safety protocols on the job sites. These safety precautions for the construction sites will include the use of face coverings, personal and job site cleaning protocols, and management of entries to the job site. I'm glad to be able to report that farmer markets and these construction businesses will be able to safely get back to work. I will provide more updates on businesses and activities that are permitted to reopen as the governor permits them to do so. I appreciate it, and with that, we'll open up to questions. I'll turn it back to Commissioner Arquich.
Questions?
I had some questions about testing. We talked about the accuracy of testing before, and you said that no test is 100%. But we came with it. You had a story about somebody who had a negative test, and there was a lot of feedback on it. A lot of other people kind of weighed in and said that they had the same thing. And I'm curious if you're hearing that there are a lot of false negatives. Is that a concern of testing, and what's your thought on the potential for false negatives in the big picture?
Yeah. So the first part of the question was, am I hearing a lot about false negatives? And so that means that somebody actually has COVID-19. They get a test and the test says they do not have it. I'm not hearing a lot about that. I've heard anecdotal stories about it, maybe a handful, but not in any large amounts. I think it's very important that people understand that every test has the possibility of what's called a false negative, which means you have the disease, but it says you don't, the test says you don't, or the opposite, which is you do not have the disease and the test says that you're positive. That actually happens even less frequently, but it does happen. So if you take a look at, for instance, the rapid test that we've been talking about for the virus and the technology that it uses, from what we can tell looking in the literature and looking at the data that's publicly available, if you have 100 people who are positive with COVID-19, these tests will detect 85 to 88 of them correctly as having the disease. And to put this in context for people, a flu test done with the same technology, that what's called PCR technology, has about the same rate of correctly identifying who has the flu. So two very different tests, two very different viruses. They're in no way related to one another. But this technology has that overall accuracy rate. So nothing's perfect, but it is the science that we have, and it's a heck of a lot better than just flying blind with no testing at all.
One of the other, there's the two different tests. One's testing for the actual virus, and you correct me if I say anything wrong, and the blood test, the antigen tests. And one question I've had that I haven't really seen an answer to is, if you get the antigen test and you have the virus currently, you were recently infected, is there a lag to when it will pick that up? Do you know if it would pick it up? You know, quickly you say, I got infected this morning and I take a test. Does it take a while for those antigens to get into my blood? So, I mean, I guess the short question why I should ask this is there a lag for the blood test as compared to the nasal swabs?
So are you talking about the antibody
Yeah, I'm
tests?
sorry, what did I say?
You said antigens, which is a different test, but we even know even less about. But so the question is the antibody test. So we'll talk about that, which is generally done with blood, with a drop of blood, a finger stick. And the antibodies are something that probably most people are familiar with. Whenever you get an infection, whether it's a bacterial infection or a viral infection, your body fights it off by forming antibodies. And there's two types of antibodies that are made. The first set of antibodies usually starts to appear in maybe 2-3 days, maybe a little longer. And then anywhere from 8, 9, 10 days later, you get a second set of antibodies. So the antibody tests are not helpful in the immediate moment. The antibody tests won't even start to be positive until at least 3 or 4 days into your illness, typically, in the typical person. And the antibody tests are all different. Some are testing for both of those antibodies, the one that happens sooner and then the one that happens later. Some of those antibody tests are only testing for the one that shows up after 10 days. So they would be most useful in figuring out if someone had COVID-19. But the antibody tests are not a good test. For instance, let's say you're a college and you want to test all your students coming back to campus in the fall, and you want to know, does anybody have the virus right now today? Then you need the virus test. The antibody test isn't going to really help you with that. The other concern with the antibody test that we've talked about before is that we don't really know yet what it means when you have antibodies to COVID-19. The World Health Organization last weekend issued guidance that as of yet, there is no proof that having antibodies gives you immunity to COVID-19 going forward. So they didn't say it didn't, but they haven't proven that it does. In other words, you might be able to get reinfected with COVID-19 even if you've had it before. There seems to be, in some of the Asian countries that are a couple months ahead of us, relatively small, but nonetheless some groups of people who seem to be getting COVID-19 again. So that is being sorted out. There could be other reasons for that. It could be they never fully got over it in the first place. But those things are being determined or trying to be determined. So for now, we just don't know with any degree of certainty what it means to have antibodies. So I don't want to get really too focused on that test yet until we understand more what it means to have antibodies and does it give you immunity.
So the virus test is the one that you're asking when you say we need widespread testing. It's
So for the question of using a test for a business to decide, okay, I employ 100 people, for them to work, there's really no way to truly social distance them. So if I want to bring 100 people back into my place of business, even with some precautions in place, I'd really like to know if anybody were positive. The best test for that is the virus test, the rapid virus test. And you could let everybody in, knowing it's not perfect, but it's better than nothing. You could let everybody in who was negative, and if anybody was positive, ask them to stay home for 2 more weeks. And then you could start some kind of regular retesting strategy. So maybe it's every week. Again, none of these things are going to be 100% perfect or foolproof. But if you're looking for a way to make a situation as safe as possible, that would be one strategy. to try to put that together. But right now, we just don't have that kind of rapid testing available, and I don't know when or if we will, so it's all a little hypothetical at this point.
And a lot of talk about a vaccine, and then there's also talk about a cure or some kind of treatment. Are either one of those more realistic in the short term, and would either be like something to focus on as we start talking about things like normal?
So the question is there a treatment or a vaccine that's likely in the short term? So if the short term is the next couple of months, let's just say, definitely not on the vaccine. And in terms of a cure, probably not. Some of you may have seen that there is one drug that has shown some promise in reducing the length of time that very sick hospitalized patients in the ICU have the disease. So that's really encouraging. And the reason it's encouraging is because some viruses don't really respond to any of our known treatments. So the fact that this virus seemed to respond somewhat to a given treatment is a good place to start. It lets us know that there's hope there for some kind of treatment down the road. The vaccines, people are moving very, very rapidly on vaccines. There are already vaccines that are being tested in animals, and there might even be one or two that are very close or perhaps have even started some trials in humans. So that's great. Hopefully some of those will pan out, but we don't know yet. So the importance of continuing to open gradually, relax restrictions gradually, and maintain social distancing for now couldn't be more important. It's what I mean when I talk about we need to learn to live with the virus, because it is going to be with us for a while for sure. And what we want to do is get things open, get people back to work, get our kids back to school in the fall as safely as possible. And that's where every one of us needs to make our own plan. We each need to think about what personal responsibility we're going to take to be part of the solution. What can we do in our personal lives, and what can we do in our work lives to make the relaxing of restrictions as safe as possible, so we don't get that a huge spike up where our hospitals could potentially be overwhelmed and we would have to shut things back down again. That would be the last thing anybody wants.
What talks, if any, is the county involved in opening schools in the fall? The Secretary of the Department of Education was on a televised interview in the last couple of days saying that he believes there's a possibility schools may not open.
The question is, what talks, if any, is the county involved in around schools opening in the fall? I have a regular conversation every week to 10 days with the superintendents from all of our school districts here in the county, and these are all things that we've begun to talk about. So at this point, we are all very hopeful that schools will be able to open in the fall, but there's a very good chance that they will look different than they looked when they closed in March, on March the 13th. So there's all kinds of different ideas that are being kicked around with maybe staggering schedules, with how classrooms are configured, perhaps use of other rooms in the building for teaching spaces, maybe rooms that are bigger than some of the classrooms, that. So they are working on all sorts of ideas. And I have to tell you, we're just so fortunate in this county. This is a group of amazing individuals who have been just on board with finding solutions from day one. And so I really have a lot of confidence in this group, and I firmly believe that if there is any way to open schools safely in the fall, and I'm very hopeful that there will be, that they're going to do it well and they're going to get it right. But I just want to point out that that goal of getting our kids back to school in the fall will be very much impacted by the behavior of each and every one of us over these intervening months between now and September. So working together, I feel great confidence that we can achieve the goal of getting our kids back to school. But if people are not willing to comply with appropriate relaxation of restrictions, maintaining social distancing, whatever we end up being at, whether it's wearing masks, being physically separated, businesses complying with extensive guidance that I believe the governor is going to be releasing early next week, all these pieces just a handful of people going rogue can really mess this thing up. So we are all in this together, and we have to take these steps for the good of our entire community and our kids, first and foremost, at the head of the line there.
On that note, another really nice weekend ahead of us. People are going to be out on trails. People are going to be packing those home and garden stores. One last word of advice before the bell rings and
Yeah.
everybody heads out.
So on this Friday afternoon, where it looks like it's going to be a really nice weekend, first of all, I want to urge everyone to take a look at that website that Commissioner Lawrence mentioned, and we'll put that up on our Facebook page and other social media. You don't have to go to the official trails. Our Planning Commission has done an incredible amount of work to identify streets and routes that are low traffic, particularly right now, because everyone should largely be at home, that are safe and comfortable for walking, running, biking. Remember, if you're doing any of those activities with people that are not your household contacts, you do need to maintain that physical distance of at least 6 feet. And when it comes to stores, you've all heard my store speeches all week. You know, folks, this is a way you can take personal responsibility. There's so many stores in our community who are doing the right thing. They are keeping track of how many people are in their store. Their stores have directional arrows in all of their aisles. They have appropriate distancing set up for their cashiers at the checkout registers. Number one, follow those guidelines if you're inside one of those stores. And number two, if you walk into a store that looks like, you know, the last New Year's Eve party you went to, turn around and walk out. Like, that's something you can do to take personal responsibility for solving this problem. Take your business somewhere else. Vote with your pocketbook. Go to a store that's doing it right. I think we should be patronizing the businesses that are behaving responsibly and doing everything they can to get this right. And if you're in one of the stores and a store employee asks you to take a step back, don't give them a hard time. Just do it. Like, that's what this is about. This is about our community coming together so that our kids can go back to school in the fall, so we can get more businesses open, so that everyone can get back to work. We have to do this together. Yes? All right. Have a good weekend, and we'll see you on Monday.